Adrian Bray, and I'm here to introduce to you nutrition and fitness, an integrative framework with cognitive processing therapy used to address PTSD. So a quick overview, we're going to discuss cognitive processing theory, better known as CPT, its origin, key aspects, nutrition and fitness, discuss how nutrition and fitness is integrated to each session. Then we'll discuss the Christian worldview and end with a summary. Cognitive processing theory origin. One of its main influencers is Dr. Aaron T. Breck, whose cognitive theory during the 1960s involved identifying erroneous and unhelpful thoughts. This theory used Socratic questioning to facilitate cognitive change, which you will see is very similar to CPT. Dr. Beck's cognitive theory also used worksheets to move the therapy into everyday life, which as the presentation goes on, you'll see is very similar to cognitive processing theory as well. CPT's initial primary focus is on past-oriented cognitions specific to the trauma. Clients who experience PTSD may express the trauma was my fault. CPT was developed by Dr. Patricia A. Fezzik. One of the first studies was funded by the University of Missouri St. Louis, and to date, CPT manuals have been translated into 12 different languages. It introduces a biological model that showcases the relationship of PTSD and CPT. Activation of the amygdala involves two types of responses, which involves strong emotions, is where strong emotions are triggered, and emergency response are activated via neurotransmitters. In normal fight or flight response, activity in the prefrontal cortex, which is the seat of the decision making and control over the amygdala, decreases, along with other immune functions and normal physical processes like digesting food in order to free all available resources for either running or fighting. During a life-threatening emergency, it is more important to activate the brainstem and neurotransmitter to aid in this fight or flight response than to have other thoughts. The prefrontal cortex is activated enough to notice when the danger is over and to send messages out to the amygdala to stop the fight or flight response and return to normal functioning. In respect to PTSD, researchers have found that the amygdala shows heightened responsivity while the prefrontal cortex shows greatly decreased activity, and that there is a functional relationship between the two. Because the amygdala is too highly activated and the activity in the prefrontal cortex is diminished, it takes a person with PTSD much longer to recognize that perceived danger has ended and to also calm down. CPT impacts this regulation through cognitive therapy, through talking about the trauma and answering questions about the trauma. CPT can be used for adults and adolescents. It was originally developed for rape victims, but have since been used for various other traumas. CPT can also be delivered within 1 month and has known to be delivered up to 60 years after the traumatic experience. One of the key aspects of CPT is Socratic dialogue. Socratic dialogue is grounded in the Socratic method of learning, which involves individuals learning something new for themselves instead of being provided this insight or knowledge from another person or in another manner. Socratic dialogue has also been known as Socratic questioning, which is, just as the word questioning says, it's a questioning method. In CPT, the preferred term is dialogue. This term is preferred because it promotes an equally balanced team approach that also adequately represents the therapeutic alliance. Socratic dialogue is used by the clinician to draw information from the client. There are 4 types of questions resolved that's consistent in Socratic dialogue. The first type is asking clarifying questions. This is 80 to 90% of the types of questions that the counselor should ask. These questions are sensitive and difficult in nature. The second type of question is challenge assumptions. This is also known as a just world belief, which means a client who experienced PTSD may think or have the thought, good things happen to bad people and vice versa. Bad things happen to bad people. Some clients may also think the thought, if I had only fought back. A third type of questioning is evaluating objective evidence that is directed towards the thought. It also consists of overestimation, as if, for example, if you had a person who experienced a traumatic event while being in a crowd, they may proceed from that point that every crowd is now a threat. The fourth type of questioning is challenging core beliefs. Pre-existing beliefs may be risk factors. These are often changed through worksheets that are introduced later in the sessions. Another key aspect of CPT are stuck points. Stuck points are conflicting beliefs or strong negative beliefs that create unpleasant emotions and problematic or unhealthy behaviors. Another simple definition for it is faulty belief that keeps a person stuck in PTSD. There are 2 types of stuck points, but first, the golden rule of CPT is to differentiate between types of stuck points for the express purpose of prioritizing assimilated stuck points over accommodated stuck points. The first type of stuck point, assimilation, is the process of altering the trauma information to fit the existing schema. For an example, a person who experienced PTSD may state, I'm a mess, I'm the problem. The second type of stuck point is over-accommodation, which drastically alters the entire existing belief system to integrate the trauma information. A client who experienced PTSD may say only bad things always happen to me. Over-accommodation can often come in the form of absolutes. While clients may experience stuck points, it is important for therapists to also be aware of any stuck points they may experience themselves. The therapist may themselves be a stuck point. Another stuck point may be the approach the therapist is taught and feel they may or must adhere to. And finally, a stuck point for the therapist may be the fear of trying new approaches. Some examples of therapist stuck points during pre-treatment, the therapist may express, my client is not ready for trauma-focused therapy. Or they may express, CPT won't work with comorbidity. During the assessment phase, the therapist may express, I can't make the client choose one trauma. During this portion, we'll discuss nutrition and fitness and its impact on a person's cognitive ability. The German philosopher Ludwig Feuerbach claimed that you are what you eat. He was probably the first intellectual to promote the idea that the food one eats has a bearing on one's state of mind. Most cognitive enhancing programs have a one-size-fits-all design and presuppose that people benefit from the intervention more or less the same way and to more or less the same degree. Here we will go over a few food items that are seen to have an impact on a person's cognitive ability. The first being lemon balm, which has been used traditionally for the treatment of dementia and amnesia. Both of these disorders are closely associated with Alzheimer's disease. A clinical trial of 42 patients during 16 weeks demonstrated the reduction of agitation and improvement in cognitive and behavioral functions after administration of lemon balm. In addition, green tea is one of the most compelling evidences for health benefits in humans. Spices such as turmeric also have scientific evidence for human studies with potential health promoting properties in cancer, cardiovascular diseases, neurodegenerative disorders, and metabolic disorders. The daily intake of herbs and spices has the potential to contribute to a better health. However, there is a need for an increase in research in the mechanism of action in clinical trials to improve the evidence base regarding the efficacy of most herbs and spices. A person's fitness also has the ability to impact their cognitive ability. Studies indicate that aerobic exercises have the potential to enhance cognition in children and compensates for cognitive decline in aging. Across the lifespan, the largest fitness-induced benefits seem to occur for cognitive control processes. Aerobic exercise has been demonstrated to alleviate depression and anxiety, to promote positive feeling, and to decrease stress. Additionally, there is a growing evidence that the high body mass index, or BMI, is associated with the frontal lobe dysfunction and cognitive deficits concerning memory processes and cognitive control or executive functions, that is, cognitive processes that are necessary for goal-directed thought and action and mental flexibility. Some of the cognitive impacts are the reduced risk of dementia, improved cognition function, improved cognitive function following bouts of aerobic activity, improved quality of life, improved sleep, reduced feelings of anxiety and depression in healthy people and in people with existing clinical syndromes, and reduced incidence of depression. During this portion, we'll briefly discuss each session, some of the goals associated in each session, along with some of the tools. In session 1, the immediate goal is to engage clients in treatment so that they don't avoid it by quitting before or after the first session, which is not uncommon in PTSD treatments. Additionally, it is important for counselors to establish rapport and also introduce psychoeducation and educate the client on the nature of PTSD, and to educate clients on the importance of nutrition and fitness and its cognitive impacts. Moreover, the explanation of the cognitive model is required to provide info about PTSD in the course of treatment so that clients know what to expect. It is important to set treatment expectations and not discuss specific trauma details with the client, and briefly review the index trauma. It is very critical to obtain patient buy-in. Clients will have homework assignments, and it's very important that the patients are committed and invested to completing and accomplishing the homework assignments to be used in the following sessions. The therapist must discuss the role of emotions, give the first practice assignment, check the client's reaction to the session, which is a common theme throughout each session, and also during this time with integrating nutrition and fitness is determine the existing nutrition and exercise patterns of the client. In sessions 2 and 3, the goal is to review the impact statement each client writes, with the primary goal of finding stuck points that have interfered with the client's recovery after experiencing the trauma. The purpose of the impact statement is to have the patient examine their belief about the cause of index event and the effects that the event has had on their life in various areas. The therapist is to continue to listen for stuck points. A quick reminder of the 2 stuck points mentioned earlier, assimilation and overaccommodation. The therapist will also ID emotions, connections among events, thoughts, and feelings. Continue to use Socratic dialogue to evaluate the thinking, and at this time, the ABC worksheet will be introduced with the goal of completing 1 sheet a day and the ultimate goal of having clients become their own cognitive therapist. It is also important to be mindful of avoidance. Therapists have to be mindful of their own avoidance, and in addition to be mindful of avoidance symptoms found in clients. These may come in the form of self-harm, dissociation, or alcohol abuse. At the end of session 2 and 3, it is also important to continue to follow up on the exercise and nutrition patterns of the client. In sessions 4 and 5, continue Socratic dialogue and distinguish and educate the client on the difference between intent, responsibility, and the unforeseeable. Be mindful and look out for blame and fault expressed by the client, and continue to review stuck points. In this session, the challenging questioning worksheet will be introduced. The goal for session 4 and 5 is for patients to take more responsibility for identifying and challenging their own stuck points and continue to strive to take over the therapy. If appropriate, shift blame or simulated stuck points over to over-accommodate it. At this time in the treatment, it is important to introduce nutrition and exercise methods and techniques to the client. In section 6 and 7, review patterns of problematic thinking worksheet. Introduce the client to the 5 themes or potential areas of belief, which are safety, trust, power and control, esteem, and intimacy. Continue to explore the nutrition and exercise pattern of the of the client. And in session 6 and 7, the therapist may also consider recording nutrition and exercise activities. The primary goal in sessions 8 through 10 is to focus on specific themes. These themes are safety, trust, power, and control. The therapist will tackle any unresolved assimilated stuck points or stuck points regarding other traumas and integrate this into weekly assignments. Continue to monitor clients' reactions and continue to monitor nutrition and fitness patterns and consider proper referrals for nutrition and fitness patterns. In sessions 11 and 12, continue to review scores and client worksheets, introduce the intimacy theme, review the assignments regarding the complement, begin to discuss therapy termination, and continue to monitor client reactions, nutrition, and fitness patterns. During this session, we'll discuss nutrition and fitness and the Christian worldview with CPT. The theme in this Christian worldview will be mind and body, as this specific approach first focuses on the client's mind and addressing PTSD through CPT, and then addressing the client's body with nutrition and fitness with hopes of it impacting and promoting cognitive development. Self-conscious is a blessing of being human in an aspect in which the burden of sin may be felt acutely. Some worldviews identify the self entirely with the spiritual aspect of human nature and see it as alien to or conflicting with the body. The capacity to reflect on one's own existence and actions to make rational choices based on such reflection distinguishes humans from other living creatures. In this way, human beings have the privilege of bearing a unique likeness to the Creator and enjoying communication and friendship with them. Through this approach, and further developing both mind and body, the hopes is that the client will be able to enjoy and embrace this unique likeness to God and further enjoying the communication and friendship with Him. Both personally and relationally, the temptation is to treat the body as a means to the end of self-gratification, ignoring its status as an integral part of human nature and denying the moral implications of choices about bodily actions. Such views are at odds with biblical accounts of the nature of the human as the union of body and soul created in the image of God and designed to represent His glory. The spiritual nature and rationality of humans reflect attributes of God in ways that other creatures do not, but the image of God is not limited to these or any particular part or capacity of a person. The body, like the soul, is essential to human nature. That the body is an integral aspect of the image of God is confirmed in the creation account of God's forming humanity of matter and spirit, the incarnation of Christ. God's purposeful creation of humans is His image as a union of body and soul has many implications. Because human existence entails both body and soul, the organic unity, the whole person makes all human choices and takes all human actions. God's design of this reality shaped norms for self-perception and personal conduct, as well as interpersonal relations, and social ethics. Only after crowning creation with humanity does God declare all he has made very good. Humans have unique dignity and the image of God in body and mind, a unique responsibility to bring him glory in every thought, word, and deed. It is the intent of this approach that a person is renewed through their mind by helping them with PTSD through CPT, and also allowing them to grow and develop their body through new nutrition methods and fitness approach in order to embrace the body and mind unique responsibility and bring God glory in every thought, word, and deed. In summary, we've covered the cognitive processing theory, CPT, its origins, key aspects found within CPT, nutrition and fitness, and its cognitive attributes and contributions to a person, how nutrition and fitness can be integrated with cognitive processing therapy in each session, along with the Christian worldview.